Hello guys, today we're going over the 5 Rs of drug administration for EMTs and also for nurses, although there's a little bit of stuff that's not going to be there that you're going to have to look at if you're looking at it for nurses. But this is definitely everything for EMTs, so we're just going to run through it. It's pretty fast, and we're going to start with the 5 Rs, and we got some bonus ones. So the first one is the right medication. So this is checking your medication name. Next, you check the right dose. For example, for epi, it would be 0.3. For aspirin, it would be 324 milligrams, and then stuff like that. So make sure you got the right dose. The route of administration, so for nitro, it would be like sublingual. For zofran, it would also be like oral. So make sure you have the right route of administration, and then the right time. So this I kind of interpret in like 2 ways. So there's like the time that you have since the last time you gave the administration. So like for nitro, it's like every 5 minutes you can administer another dose. But also the right time is in like the right indications. Like it is like the right time to give this. The patient is in the right, has the right indications and doesn't have any contraindications that would prevent them from getting it. So that's kind of how you can interpret right time. But the book said it was for like since the last dosage. And then the right patient. So this isn't really a problem for you unless it's like an MCI drill. I guess you could also interpret this as like whether or not they have the right indications. So this is like the right patient to give this drug to. But yeah, so like it's kind of weird in that case, but because you only usually have one patient. But I guess if you're in like an MCI drill, that would be somewhere. Or if you have maybe 2 patients in the back of the ambulance, that could be another reason why you would want to double check the patient is the correct one. And then there's also 2 more things that I never learned about in school, but I mean, we did learn about it. It was just not like part of this algorithm or like this list, I guess. It's the right to refuse. So when you explain to them what you're doing, if they're like, no, I don't want it, you cannot give it to them. And then also, that is not spelled right, but response, the right response. So this is like after you administer it, when you're rechecking vitals, after you've established a baseline, you want to make sure that you're actually getting the right response, like what you expected would happen. So yeah. And then, like for example, for aspirin, you'd hope they have less chest pain, or at least not worse chest pain, at the very least. So this is another thing I found that I thought was kind of cool. Obviously, you have a partner. You want to make sure you're confirming everything with your partner. This was from Chicago EMS, and I thought it was kind of nice. And we didn't really review it too much in school, but it's kind of nice. So this is like, you are this side of it, and then your partner is this side of it. So basically, you're going over this with your partner. You're like, okay, I want to administer epinephrine, or I want to administer like aspirin. What's the dose? 324 milligrams. The route is like chewable tablets, oral, 324 milligrams in 4 tablets. Drug name, aspirin, indications, chest pain, and no sensitivity or allergies. Well, actually, that's the next part. That time since the last administration, if they took aspirin before, and if everything looks good, your partner's like, yeah, go for it. And then contraindications, that would be like if they have an allergy to aspirin, or if they had hypersensitivity to aspirin in the past. And you can discuss that, because obviously there are 2 types of contraindications, at least I know of, and those are relative contraindications, where there's like a bad side effect, but you can still give it if the case or the situation necessitates or like really requires it. And then there's absolute contraindications where you never give it. If there's relative contraindications, you should probably call the medical director to just get it like doubly signed off on, and to weigh the consequences for giving/not giving the drug to make sure it is better to give the drug. But yeah, so you discuss contraindications with your partner, and your partner's like, yeah, go for it. And then finally, you draw and confirm the dose. You show it to your partner. You show the bottle to your partner to make sure it's the right bottle. And here you should probably also mention the expiration date. That was not here, but you should also double check the expiration date. And yeah, make sure you're drawing and confirming the right dosage before you give it, so you're doing it before and at the end of the conversation, and your partner's like, go for it, and then you chuck those tablets very gently into the patient's mouth. And yeah, that's everything I've had for you for today, and that was a really short one. I just recorded like a 40-minute one, so this is a very nice little break, but stay faithful, stay focused, and God bless.